Welcome. Today we explore epidemiology, the study of how disease occurs, spreads, and is controlled within populations. Think of epidemiology as medical detective work used to protect public health. Epidemiologists track disease occurrence, distribution, and determinants in large groups of people. By studying these patterns, we learn to control outbreaks and ultimately save lives. Before the rigor of modern science, medicine was divided. Many believed in the miasma hypothesis, attributing diseases to bad air or foul odors. However, the emergence of germ theory provided a biological basis for infection, shifting how we understood the spread of disease. Pioneers like John Snow and Florence Nightingale transformed medicine. They stopped relying on folklore and began using rigorous data collection to identify real causes. This pivot toward data-driven insights established the foundation for modern epidemiology, turning our focus toward observation, mapping, and objective proof. In 1854, London was struck by a devastating cholera outbreak. At the time, scientists didn't fully understand how the disease spread. John Snow, a visionary physician, decided to map the outbreak instead of simply guessing. He plotted each case on a map of the Soho district. He noticed a clear pattern. The cases weren't scattered randomly, they clustered around a single source, the water pump on Broad Street. By identifying this common source, Snow revolutionized public health. His work proved that cholera was waterborne, establishing the foundation for modern epidemiology. Common source spread occurs when a single origin, like a contaminated well, infects many people simultaneously. Imagine it as a faulty pipe leaking into a city water supply. Because the origin point is shared, the outbreak happens almost all at once. This identifying characteristic helps epidemiologists trace the source back to a single, localized point. Common source spread occurs when many individuals are infected from a single source. However, the nature of that exposure can vary significantly. A point source spread is a brief, simultaneous exposure. Think of a single bad dish at a picnic. Everyone eats it at once, and the illness peaks sharply before disappearing. Continuous source spread involves prolonged exposure. If a water system is contaminated, people continue to fall ill as long as the source remains active, leading to a flatter, extended epidemic curve. Finally, intermittent source spread happens on and off. Like a faulty factory machine that releases a contaminant only when it overheats, the illness cases appear in irregular clusters. By identifying whether an outbreak is point, continuous, or intermittent, epidemiologists can pinpoint the exact cause and stop the spread. Florence Nightingale was far more than a nurse. She was a brilliant statistician who recognized the power of data visualization. During the Crimean War, she meticulously tracked mortality rates. Her analysis revealed a shocking truth. Far more soldiers were dying from poor hospital sanitation and preventable infections than from the combat wounds they initially sustained. By presenting these findings in innovative wedge charts, she forced the government to reform sanitation standards. This revolutionized public health, saving countless lives and establishing data as a cornerstone of medical practice. In the mid-19th century, surgery was incredibly dangerous. Patients frequently survived the operation only to die from post-surgical infections. Joseph Lister, applying epidemiological evidence, recognized that microscopic organisms were the culprit. He introduced carbolic acid to sterilize surgical instruments and wounds. This simple act of disinfection drastically reduced mortality rates, turning hospitals from places of fear into environments of healing. Lister's work cemented the link between germ theory and surgical practice, saving countless lives. Epidemiologists classify research into two core methodologies, depending on how they engage with the population. Observational studies involve watching patterns unfold in the real world without any researcher interference. Experimental studies are where researchers actively manipulate variables, such as testing a new medication, to determine if an intervention is effective. Observational research provides a snapshot of natural occurrences, while experimental research acts as the controlled test to confirm causation. Descriptive epidemiology is the first step in solving a health mystery. It is the exploratory phase where we act as detectives. By interviewing patients and scrutinizing medical records, we look for commonalities among the sick. These observations allow us to develop a hypothesis, a starting point for our investigation into how the disease is spreading. Once this hypothesis is formed, we can move from description to rigorous analytical study. Analytical epidemiology takes the hypothesis developed in descriptive studies and tests it rigorously. By selecting specific, randomly assigned groups, researchers look for statistical associations between risk factors and the disease outcome. In analytical epidemiology, researchers approach a study by deciding which direction to look on the timeline of disease. Retrospective studies look backward. Researchers identify individuals already affected by a disease and dig into their past medical histories to identify potential exposures or causes. Conversely, prospective studies track healthy individuals forward in time. They observe who develops the disease, allowing researchers to gather real-time data as it happens. Both methods provide unique insights, helping epidemiologists piece together the puzzle of disease etiology from different vantage points on the timeline. Cohort studies are a cornerstone of analytical epidemiology. They involve tracking groups of people over time, categorized by their shared characteristics, like exposure to a specific factor. Researchers select groups that differ in their exposure to a variable of interest. These groups are then monitored prospectively to observe the incidence of a disease. By following these cohorts without manipulating their choices, we identify correlations between specific behaviors and future health outcomes. Because the researchers do not manipulate the subjects' lives, cohort studies are powerful tools for observing real-world patterns in disease incidence. Case control studies are a powerful tool when investigating rare diseases. Instead of waiting for people to get sick, we start with people who already have the condition. We then select a matching group of healthy individuals, known as controls, to see if they share similar past exposures. By looking back into their medical and personal histories, researchers identify potential causes. This retrospective approach is incredibly efficient, allowing us to narrow down risk factors without years of tracking. A cross-sectional study is like taking a snapshot of a population at one specific time. It is a powerful tool for determining the prevalence of a disease. Imagine surveying a large group of people simultaneously. We record their status at this exact moment, who is currently healthy and who is affected by the condition. Because it looks at everyone at the same point in time, it is highly efficient for spotting immediate associations between factors and disease prevalence. By capturing a moment, we can accurately calculate the proportion of the population affected right now. This is the definition of disease prevalence. Experimental epidemiology moves beyond simple observation. Here, researchers actively intervene to test the effect of a treatment or a lifestyle change on a specific outcome. Participants are split into two groups. One receives an intervention, such as a new drug, while the other receives a placebo to keep other variables constant. By tracking both groups over time, researchers can isolate the treatment's effect. This controlled design is what provides the highest quality evidence for causation. In experimental epidemiology, the randomized controlled trial is the gold standard for proving that a treatment actually works. But human expectations can skew results. If a patient knows they are receiving the real medicine, they might feel better simply because of the placebo effect. To fix this, we use a double-blind design. In this setup, neither the patient nor the doctor knows who is receiving the treatment versus the placebo. By removing this information, we eliminate observer bias and the placebo effect. This rigor ensures that the results reflect the medicine's true efficacy, not just human hope. Let's apply our knowledge to a real-world scenario. During a recent holiday, a salmonella outbreak occurred, leaving many families feeling ill. Epidemiologists used descriptive interviews to investigate the common links among those affected. They discovered a common factor, a specific dish served at the gathering, the turducken. By identifying this link, investigators could trace the salmonella source back to its origin, effectively stopping the outbreak. In an epidemiological investigation, identifying the source is critical. This specific case was a common source outbreak. Analysts traced the illness back to a single processing plant that supplied the contaminated turduckens. By mapping the patients back to this specific supply chain node, epidemiologists confirmed the source. This proof demonstrates how precise food tracking protects public health. Once the source of an outbreak is confirmed, public health officials take decisive action to contain the threat. First, they initiate a recall. This ensures that potentially hazardous products are immediately pulled from distribution and store shelves to protect the public. Next, inspectors visit the facility to pinpoint exactly where and how contamination occurred, ensuring that the specific hazard is neutralized. Finally, safety protocols are updated. By implementing stricter regulations and new quality checks, officials work to prevent the outbreak from ever returning. By 2026, the landscape of epidemiology has fundamentally shifted. We no longer wait for manual reports. We harness the power of big data, instant genomic sequencing, and digitized health records to track pathogens in real time. This technological leap allows public health systems to detect, analyze, and contain potential outbreaks in mere hours, significantly narrowing the window of opportunity for disease transmission. Modern precision epidemiology fuses high-resolution molecular data with individual travel patterns to map outbreaks in real time. However, these powerful surveillance capabilities create a delicate ethical challenge. How do we protect public health while strictly respecting individual privacy? We must ensure that digital surveillance tools are transparent, secure, and used only to foster collective health. At the heart of modern epidemiology lies the One Health framework. It recognizes that human health is inextricably linked to the health of animals and our shared environment. By studying these systems together, we can predict zoonotic jumps and prevent the next global pandemic before it spreads. From Jon Snow's humble pump handle to today's real-time digital surveillance, epidemiology remains our most vital tool for public health. It is not just about tracking disease. It is about turning complex data into life-saving action, protecting our collective future.